We're back now with our Mental Health Thursday segment, and tonight we're diving into the mental health of your youth.
Yeah, teens have to juggle a lot, right? From home life to school and, of course, social life. So as we've seen, society can be hard to navigate and even really traumatic at times. So how can families and teens alike navigate through this difficult and kind of murky reality?
Yeah, joining us now is Dr. Taylor Nicoletti. She is an assistant clinical professor at Notre Dame and specializes in trauma care, especially children and families in urban low-income settings as well. Doctor, it's so good to have you with us for the first time. Thank you.
Thank you so much.
Yeah,
we have to talk about this because I think the problem itself lies within kids and teens who are going through it right now. So there's a CDC report that showed 1 in 3 high school students reported that their mental health was not good most of the time or always. Can you walk us through some of the factors, some of the reasons possibly that is?
Yeah, that's a great question. I think number one, that data piece, right? 1 in 3 youth, most of the time are saying their mental health is not good, right? And that points to something beyond an individual concern. That's a community issue. We should all be invested in addressing this problem. And research shows that there are a lot of factors, right? Teens are going through academic pressures, social media issues, bullying, cyberbullying. A lot of our kids, especially in our community, have chronic stressors. They're facing racism or poverty or community violence, right? All of those things impact them on a day-to-day basis.
Yeah.
We also know that there's data for young girls and LGBTQ+ youth who have an even harder time dealing with their mental health. So it makes sense that, okay, this is like a ripe issue. But also, what we want to highlight is there's the research that just shows all these concerns. There's also research that shows what helps.
Okay,
right?
good.
So protective factors, things that help fight against mental health concerns. First, having a trusted adult in your life.
No, that's huge.
That could be a caregiver, a parent, a coach, a teacher, right? You think about social media and the use of social media in appropriate ways. That's huge.
Yeah.
When you think about, working with kids who are in academic settings, so making sure that they feel safe in academic settings, making sure that they have a sense of cultural identity and belonging, access to mental health resources, and we want to reduce the lethal access to different firearms or things like that. All of those things. There are so many factors that are hopeful that we can do to build resilience.
So many resources. You touched on the word trauma. Talk about that, because what exactly does trauma mean?
I love this question. I love it because, one, there's so much misinformation and confusion about trauma, right? But then two, you can't talk about trauma without also talking about hope and resilience and survivorship.
They have to be a side-by-side conversation, right?
Exactly. It's beautiful work. So first, trauma, it's more than just an event. It's more than just one instance of something. It's the way that children respond to that event. And even there are different children that are going to respond differently to the same exact event, right? So we want to pay attention to that piece. So trauma shows up a lot in behaviors, right? Hyperactivity, withdrawal, irritability, disruptive behaviors in the classroom. What you or I might say, that's a bad kid. No, that's a kid whose brain is on survival mode.
Wow.
Right?
That's huge.
So that's how I like to describe trauma.
I think that's perfect.
We don't talk enough about suicide. Obviously on the news we don't talk about it enough because we want to prevent copycatters from potentially doing something, but it's important to talk about, especially when it comes to teens right now. Can you talk about that? I know you're going to be talking at an event about this because it is prevalent even here in Michigan.
Yeah,
right?
it's happening all the time.
Yes, unfortunately, suicide rates are increasing, right? It's the #1 or one of the leading causes of death among youth in the U.S.
Wow.
But again, the good news is that there are so many ways that suicide is preventable. There are things we can do in our homes even asking a youth, have you ever had thoughts of wishing you were dead?
Wow.
Right? That doesn't cause a child to want to hurt themselves, right? It actually opens the door for communication, and it opens the door to figure out what resources do you need and how do we make sure they have access to that.
Yeah, and gun violence. Let's talk about that because we've had these stories quite a few times on our newscasts. People get into fights, they grab a gun, and they're little kids involved in violence that changes their lives. Talk about kids and their feelings, how can we navigate that so we don't always turn to violence, right?
The thing I like to talk about is young kids don't always know how to talk about their feelings.
No.
Adults don't always know how to talk about their feelings,
No,
right?
Absolutely, yeah.
So it really comes from modeling, right? Parents or educators describing how they feel, being open enough to say, I felt scared, I felt worried, I felt ticked off in that moment, right? Being able to model that for your child or for your youth and how to cope with that stress, that's the #1 way for children and youth to be able to then learn, this is how I deal with my stress.
Yeah, absolutely.
And you can see that number right there, 988. That is an important number. We always bring up when we talk about topics like this one. Really quickly, there are so many ways that people can follow you and potentially listen to you talk about different events. I know you got a couple events coming up as well, correct?
Yes, yes. So the Notre Dame Veldman Family Psychology Clinic, we are really focused on getting mental health information out there into the community. We don't want it to stay in the classroom or in textbooks. It needs to be in the hands of our families that we're working with, right? So we have 2 events coming up. The first one is in Elkhart on October 9th, and the second one is on October 16th in South Bend at the Boys and Girls Club. Both those events are going to be surrounded around mental health and supporting families with really practical tools.
So good for parents and teens.
Yep.
Yeah,
Get
that's
some
great.
get good keys that you can take home.
I think so, and life-saving potentially as well. As you can see that number one more time. Dr. Nicoletta, thank you so much for
Thank
being
you.
here. You need
Thank
your own
you.
show, but we'd love to have you back.
Yeah, you're great. You make it very simple and easy to understand, actually.
And it's very
which
complex.
Is,
It's very complex to talk about. So
It
thank
is.
you.
Thank you.
Thank you.
Thank
Let's
you.
get a check of the forecast. Hey, Jack.